I'm Amanda Olsen, and I'm a pelvic health physical therapist, and we are going to discuss what the pelvic floor is. The pelvic floor is a series of muscles that supports the pelvic organs, but because of its location at the base of the pelvis, it's also a member of the core musculature, so it helps support our spine and our hips, and it works together with the abdominal muscles, the spinal muscles, and the diaphragm in your rib cage to help provide stability to the entire trunk. It's also important in the roles of continence, sexual health, and our bowel movements. So the pelvic floor muscles are a series of muscles. Everything that you see in red here, starting from the pubic bone, swinging wide to where we sit, and then coming back to the tailbone. And they surround the urethra, the vagina in women, and the rectum. Interestingly, everyone has a pelvic floor. Men have it, trans people have it, women have it. And in men, of course, it's only surrounding the urethra and the rectum. In women, it supports the pelvic organs, which include the bladder that you see in front, the vagina and the uterus in the middle, and the rectum in the back. What you can see here is these organs are very snug. They are 3 tenants in a small apartment living in the pelvic bowl. I'm going to take them out and show you the deeper layer of the pelvic floor muscles. And they are everything you see in red here. So the pelvic floor muscles have 2 layers. They're connected by fascia, which is a connective tissue that helps bind them together. And it comes all the way to the front of the pubic bone here, swings down all the way to the tailbone, and all the way out to the sides, to the hips. For this reason, the pelvic floor muscles support all those muscles so that when we cough or sneeze, laugh or jump, they contract and support the organs so that we don't leak urine. And then when we need to have a bowel movement, they drop and they relax to allow for the bowel movement to happen. So for this reason, we want our pelvic floor muscles to be strong, but also flexible and mobile. We want them to have good timing and coordination when we cough, sneeze, or laugh, and we want them to know when it's time to relax. Another time that they need to relax is during penetration, whether it's placing a tampon, having a medical exam with a speculum into the vagina, or having penetrative intercourse. We want the muscles to be flexible to allow for that to happen. The pelvic floor muscles can be trained if you notice any issues that are coming up, such as incontinence, urinary urgency, pelvic pain, or constipation. The pelvic floor muscles can be retrained with the help of a pelvic health physical therapist or occupational therapist. In our next video, we're going to discuss those symptoms, but if you are noticing any pain or discomfort in this region, it is helpful to see a pelvic health physical therapist or occupational therapist that will do an exam, help determine what the driver of your issue is, and help prescribe a plan of care to help you reach your goals. For more information and to discuss your unique condition, be sure to contact FemStrong Health. FemStrong Health is a collaborative team of multidisciplinary clinicians that work together to get you feeling your very best.